In 2018, the United States Agency for International Development's Bureau for Humanitarian Assistance funded Save the Children to lead a 3-year initiative to augment global capacity to respond to major disease outbreaks. Through a consortium of partners, the aim of the READY initiative is to supplement existing efforts to build and retain operational and technical capacity among NGOs, local or international, and other stakeholders to more quickly and effectively respond to major disease outbreaks in humanitarian settings. Hello, everyone. My name is Maria Tsolka. I'm leading the Integrated Framework Initiative of READY Consortium, and I would like to welcome everyone at our webinar, Integrating Technical Sectors in a COVID-19 Response. Furthermore, I would like to thank READY Consortium for the collective effort of the technical team that produced this framework, BHA for funding support, and you all today for being here with us. Next slide. Before we start though, for our French-speaking participants, there is French translation available. So please go to the interpretation icon below and select your language of preference to continue. If you would like to mute or unmute the original audio, click on the corresponding option in the language button. Next slide. I would like to, you'll give me 1 second because at the same time I can hear the French translation. Beatrice, is this something from your side? Is this something from your side? I can hear our French translation simultaneously. Let's continue. Yes, but we will sort it out, don't worry. Okay? Let's continue. So, excuse all of us. Some technical problems on that. Okay, I still hear you, so maybe, and I'm off the language. Okay, thank you very much. So we will continue. Apologies for this technical problem. Let's continue discussing a little bit our agenda. As mentioned, our webinar today will introduce the integrated response framework, and we will continue with a panel discussion. Before jumping to our panel, let's talk about READY and the framework. Next slide. READY typically works across 3 main areas: strengthening NGO capacity to understand and engagement in outbreak response coordination mechanisms, strengthening NGOs' operational readiness to respond to major disease outbreaks, and contributing to technical readiness through the adaptation and development of technical tools and guidelines for outbreak response in humanitarian settings, like the one we are presenting today, the framework. Next slide. In September 2020, and in response to the COVID-19 pandemic, we developed an integrated response framework for isolation and quarantine as non-pharmaceutical interventions against COVID-19. Most recently, we updated selected resources and tools so as to reflect on the new evidence and development of the pandemic. The framework focuses on enabling holistic services around quarantine and isolation in the household, as well as quarantine facilities and community isolation centers. This framework is a result of extensive desk research and numerous consultations with colleagues from international NGOs, such as the International Medical Corps, the International Rescue Committee, UN agencies, including WHO and UNICEF, academic institutions such as the London School of Hygiene and Tropical Medicine, Johns Hopkins University, our global and regional Ready Initiative partners, as well as Save the Children's regional and country offices. But let's take a pause here as we want to hear from you and your experiences. We will share a quick poll with some questions about integration. Please go ahead and respond in the next 2 minutes. We are at 50% voting and still rising. So for the ones that have not finished with their voting, please go ahead. I'm sure many of you have changed challenges around integration, especially if you're first responders in an emergency. So we definitely want to hear from you and your opinions. We have a little bit of extra time to finish our questions and the quick poll. Thank you all for voting. So, do you believe integrating technical sectors is an important consideration in COVID-19 response? This is striking, 100%. And I see many of you being involved in integration, and it's very interesting also to see how organizations are not always providing clear guidance on how to achieve integration. And looking also about what you think about the benefits of technical integration, humanitarian response programming. It's great as we can continue discussing the importance of integration. So that said, what do we mean when we talk about integration in humanitarian settings, and why is it important, as we discussed? I know 100% of you decided that it is important. Integrated programming holistically addresses the multiple and interrelated rights, needs, risks, and vulnerabilities of individuals and communities. An integrated approach ensures that interventions from different sectors and teams do not take place in a silo, but instead reinforces one another to achieve the best possible outcomes with existing resources. Integrated programming holistically addresses the informational, clinical, psychosocial, and structural needs of communities in humanitarian settings, engaging them in decisions that work within their context, while addressing concerns and feedback builds trust and ultimately saves lives. Next slide. The importance of multi-sectoral integration and a holistic and people-centered approach in epidemic preparedness and response has become a common feature of infection disease policy and practice in humanitarian settings and beyond, as we all know by now. However, to date, this integration remains inadequate, fragmented, with limited reach and small initial investment. Whether you are a public health expert responsible for managing the COVID-19 programming in your organization, local or international, or a WASH officer at your sub-district office, or you are a frontline worker responsible for contract tracing, You are likely to encounter working in silos within your own sector-specific activities, having trouble to meaningfully engage with others and create integrated outcomes for the affected population. This issue becomes even bigger when your organization is small and is focusing only in selected sector-specific activities, for example, protection for women and girls during isolation and quarantine. It is very likely that you will face challenges in coordinating with others and often forget all the pieces of the puzzle that are important and formulate a minimum package of support for families and individuals that find themselves in isolation and quarantine during humanitarian crisis. Next slide. REDI's integrated response framework for isolation and quarantine as non-pharmaceutical interventions against COVID-19 is primarily a programming tool for non-governmental organizations, mostly operating in humanitarian settings, who are providing services to people in isolation or quarantine in their homes or community facilities. It is available to download at www.readyinitiative.org, and I would highly suggest to take some time and also watch the videos that accompany the framework. They are all under 5 minutes long, and technical experts that actually contributed to this effort will guide you on how this framework can help you. You also can find the link now at the chat box if you want to bookmark it. Next slide. Before we go and meet our panelists, though, let me also tell you a short story about how this framework can help you. When the COVID-19 pandemic hit the world last year, nearly 168 million people were in need of humanitarian assistance and protection, according to OCHA Humanitarian Overview Report in 2020. This represents 1 in about 45 people in the world and was the highest figure in decades. Many of them already living in dire conditions, they had to face community-level mitigation and containment public health strategies like everybody else in the world, and they found themselves isolated or in quarantine at their own homes or at community isolation centers. Mohammed, who is a fictional character, is a community leader who lives with his family in a rural area with limited access to health facilities and clean water. He lives with his wife, 4 children, a nephew, and his father in a small, poorly ventilated home. After he comes in contact with a COVID-19 case, his household members must isolate and quarantine at their home while he resides at a community isolation center near the closest referral hospital in order to ensure access to critical care if he needs it. Next slide. When you and your organization are designing programs and interventions to support families like Mohammed's, here is how you can use the framework to guide your integrated activities. Let's assume you're working for a local organization. Your organization provides wash and nutrition services at the community where Mohammed and his family is located. The framework has sector-specific technical and operational guidance across health, including reproductive, maternal, newborn, and child and adolescent health, nutrition, water sanitation and hygiene, food security and livelihoods, and protection, including gender-based violence and child protection. And this is the inner light blue circle of our framework. At the foundation of this approach is risk communication and community engagement, which builds trust in the response, supports community with timely, accurate, and actionable information, and grounds integration in the community's needs. The framework also addresses cross-cutting themes of gender, ethics, and One Health linkages. All very important considerations to holistically cover the needs of Mohammed and his family. So for example, if you are a technical advisor or a program manager at the organization we mentioned before, you can use this framework to help guide you on how you can collaborate with other sectors like health, food security and livelihoods, and child protection in order to provide services to children who may have to be quarantined at the household or in a quarantine facility. The framework is organized to provide ideas for integration across multiple entry points, including coordination, planning, project design, and monitoring and evaluation. Next slide. If we go back to our local organization that provides wash and nutrition services to the family of Mohammed at their household and also supports the community isolation center where he stays, you will find additional activities that you can integrate and enhance the outcomes of protection. Specifically, I will mention two as an example here. Ensure, for example, that all outreach, wash, and nutrition frontline staff know that they play a critical role in protecting children. All staff and volunteers must be aware of existing referral pathways and feel confident to safely identify and to refer a child protection concern. Ensure that boys and girls were considered in the design and planning. This may mean specific considerations for adolescent girls or ensuring child-headed households are able to access food. For health, for example, we would want to ensure practitioners know how to preserve information from unaccompanied children to support family tracing and reunification efforts. More detailed guidance you will find in the framework sector-specific tables. Next slide. During the COVID-19 pandemic, it is also crucial to integrate with the health sector, who is leading the response, and coordinate also with the Ministry of Health and other organizations that deliver health services in your area. Even if you are not providing health services, your organization must be systematically participating at any COVID-19 specific coordination mechanisms at your area. Other considerations that are mentioned in the framework include planning the location of wash facilities at locations that will contribute in better health outcomes and making sure women and girls of reproductive age have access to private and gender segregated facilities. If you are distributing hygiene kits, you can integrate menstrual hygiene items designed together with the community and incorporate COVID-19 messaging during distributions. There are so much we can do if we work together. Again, I will stress you to visit the framework for further information and guidance. And now, without further ado, let me introduce you to our panelists. Would you like to come in front and have everybody on board here? Thank you very much. So today, for the discussion, we have together with us Kathryn Bertram, Social Behavior Change Advisor, Johns Hopkins Center for Communication Programs. We have Lori Murray, Senior Humanitarian Child Protection Specialist, working for Save the Children, and Claudio Deola, Senior Humanitarian WASH Advisor and co-lead of WASH Technical Working Group for Save the Children. So let me start with the first question for the group we have here. And I will start with you, Claudio. Can you talk through how we can work as a team to apply the integrated framework in designing a program? If I am in an outbreak response and overwhelmed, which is very likely, where do I even start with integration?
Well, thank you for the question, Maria. It's a very good question that could help us in providing some example and clarification. So where would I start from if I want to facilitate an integrated response to an outbreak? I think that in line with this integrated framework, if I found myself in such a situation, I would first and foremost, I will take my wash hat off Yeah, and then I will dress instead a public health hat. And I really think that this is the best way to start working and collaborating with colleagues and other actors. So take your sector hat off and start to promote, I don't know, for instance, a multi-sectoral working group, for instance. Um, in fact, we know that one of the main barriers that we identified for an effective and integrated public health response, it's the lack of a common language. It's a lack of a common language. That means that a lack of a shared conducive environment, and I think that this is where the integrated framework can be really helpful. There are also other challenges that are when it comes to an integrated public health responses, and those challenges can range from limited intersectoral coordination to a lack of planning and leadership, or again from having too many agencies with too many mandate and expertise to a lack of adequate fundings, and again from lack of interdisciplinary skills to the poor use of data, which in turn could lead to shallow and superficial epidemiological analysis, for instance. So all these factors often lead to missed opportunities when it comes to complementarity, and also to reduce the capacity of the sector to develop causal links. And by causal links, I mean those body of evidence that are so fundamental and so necessary to advocate for more integrated public health responses, and also therefore to leverage for funding, for more adequate funding. Um, so what is integration? I mean, what are we meaning by integration? I think we all kind of know that integrated programs normally they start with the capacity of identifying multiple and interrelated rights, need, risk, and vulnerability of individual and communities. And so they normally start with joint need assessment, and also with holistic analysis of those cultural norms that regulate behaviors, you know, and all these we really believe that it should be done together with the affected communities, with the affected medical staff, and with the affected national and local coordination mechanism. We will speak just later on about how important is. I mean, it's being local, but before that, I think I'd like to remind that this integration and this dialogue, it is important that we can sustain it and sustain it throughout all the project cycle management and all the cycle of the project. And how we sustain this, I think, is just, we believe that is to be sure that there are in place since the very beginning strong and clear leadership and coordination mechanism. Yeah. So, and then that would facilitate the joint planning and write proposal jointly and formulate joint strategies, and also cross utilizing human resource, not only across organization but also with the governmental bodies, which are the ones that are at the center, because again, I mean, the most way to build an integrated response is to start locally, is to look at local realities, is to work hand by hand with provincial teams. And so local capacity and knowledge are very important with their own specificity, and how they are linked to the context, and with their own strengths, and also sometimes their weakness are extremely important. for instance, like when we speak about national and subnational coordination mechanism, when we speak about national organization, civil societies, volunteer, and they are all at the center of this process in a response to an epidemic. They are all in the eye of the cyclone, I mean. And in this regard, I would like maybe to cite Mahatma Gandhi, who said that what you do for me, but you do without me, you do against me. So I found this quite enlightening for this discussion. So let me come back quickly to the common language as I initially mentioned. So I'd like to remind and to explain what we mean by common language. I think common language in public health is taking one humanitarian sector and use it to cross-pollinate the other sectors. And then maybe I can conclude with some example of this cross-pollination, what we mean by cross-pollination, and then you can find them in the integrated framework in great detail. But for instance, number one, building the capacity of doctors or medical staff on wash and nutrition, for instance. Number two, it's like the other way around, explaining to an engineer how and why mental health is so crucial in dealing with epidemic. Or again, being inclusive of children, women, and other highly vulnerable groups. Or I don't know, let's say, for example, again, for instance, conceiving your indicators in a way that there is a clear link to health outcomes. And maybe last but not last, it's being sure that we are discussing across sector and with the affected people on what are the most effective messages that we want to deliver to the communities and with the community themselves. So I think this is how we can see the framework, and now I would start my job if I found myself in such a situation. But I think I'm taking a lot of time. So now, for the sake of time and also to enrich the discussion, I like to give the floor to some of our colleagues, and then to let them elaborate on some of the points that I quickly touch upon. And then, for instance, as I quickly mentioned, leadership and coordination are pivotal, and they can be a challenge in integrated programming, right? So, and then, for instance, Kathryn, would you mind to tell us and to tell to the audience what are the tips that we can find in this framework that would be helpful when we speak about leadership and coordination? If you don't mind, I hand the floor to you, and thank you.
Yeah, thanks so much, Claudio. And I think you touched on some of these, but thank you. Let me start by saying that I think despite being a contributor to this document, I also learned from these practical tips. So at the end of the day, as Claudio was saying, and as Maria was touching on as well, we're all really working together toward improving health and well-being outcomes during this pandemic. And so we should be thinking about these connections more, regardless if our job is to specifically integrate or not. You know, we can agree on our impact. We can agree that our impact in providing nutrition services, for example, to a community that is dealing with economic losses and increased gender-based violence will be more significant when connecting and integrating with other services. So we can earn communities' trust by responding to their real needs. This tool gives me a better sense of how to do that and to see how other sectors are operating so I can plan accordingly. As was mentioned, there are recommendations for integration along a project cycle. So each of these has tips to carry out these recommendations. So Claudio, you asked about coordination and leadership. Let's start with coordination. The framework provides examples on using task forces and working groups to plan integration. This could include, for example, a quarantine working group that has voices from the different technical areas like WASH, like protection, including child protection and gender-based violence, and so on. And importantly, that a mechanism exists for closing community feedback loops across sectors. This last part was a key learning from the Ebola outbreak in West Africa and then DRC, to have multi-sectoral teams discuss and follow up on recommendations resulting from this community feedback. And I don't know if any of my IFRC colleagues are online, but this sort of process brought about an important change in course for another response pillar in DRC. As noted in the framework, the idea here is not to replace an existing coordination mechanism necessarily, but rather to enhance coordination by including other sectors, and importantly, community voices, as Claudio also touched on. Those community voices are critical, as an integrated response really should be in partnership with those communities, designed with an understanding of the community's support needs that they've defined, often based on data they've been trained to collect. People can discuss a variety of concerns and be referred to services they may need now or later, such as protection services or cash vouchers. There is an example in the framework of how in Bangladesh, a child protection working group advocated having child protection volunteers make daily visits to quarantine centers to provide psychosocial support, run activities, and check on unaccompanied children's well-being. And this was added into the overall health response there. There is a tip in the framework on ensuring an integrated approach is included at the proposal stage, where we can jointly plan and target people in quarantine or isolation. We can consider adopting a consortium approach to achieve that end. So consider that different sectors, take WASH and nutrition, can identify similar social norms or other drivers of behavior that they want to collectively address to change behaviors, and then jointly plan community engagement and behavior change approaches in a way that speaks to the greater needs of different audience segments or people. While making these connections seem obvious on paper, it really requires someone to put that energy behind organizing it, as anyone who has worked in a coordination role knows all too well. Another tip then is to ensure clear integration roles in internal positions across sectors, with trainings on implementing integration approaches. For example, a public health lead can have a specific role of bringing protection, health, nutrition, and WASH programs together to jointly design these integrated program approaches and activities. You can lay out the expectations of a program manager to support cross-sectoral collaboration on activities, such as assessments, as was said, and as I mentioned, joint targeting of beneficiaries and community engagement. Save the Children did just that, using a cross-sectoral health and nutrition technical advisor, for example, in a migrant response project in Colombia, to ensure integration across humanitarian programming. So that person then was accountable for ensuring this integrated approach. On that note of accountability, I want to turn it over to Lauren now. Lauren, can you say more about the joint planning for MEAL for monitoring, evaluation, accountability, and learning?
Absolutely. Thanks so much, Kathryn. And I see in the chat box, there's already a question about this. You know, we're all behind integration, but how are we actually measuring success? And how are we saying that we have successfully integrated and it's had an impact on people's lives? So we couldn't necessarily talk about the integrated framework without discussing monitoring, evaluation, accountability, and learning, or MEAL. MEAL, as we know, is critical to all of our sectors as standalone, but it's even more important and critical when we're measuring the success and benefits of integration. A robust MEAL system will help us to capture and document good practices, learnings, and ultimately see if we've been successful in achieving integrated outcomes. The framework provides resources on which indicators can be used to measure the effectiveness of an integrated model. This is really helpful as it can contribute to learning and improvement of integrated programming. And it can be used for new program design. We learn from our previous work, what worked well, what didn't work well, and what did communities tell us. Beyond these resources and these lists of indicators, there's a few practical tips in the integrated framework. For example, one of the tips is to conduct joint technical advisor visits to look at planning, monitoring, and ongoing support to projects. So these visits are valuable to identify further opportunities for increased integration, but it's also an opportunity for us to learn from one another and also to learn how do other sectors measure success? Where are we doing it the same? Where are we doing it differently? So for example, if I'm putting my child protection hat back on, we wouldn't consider ourselves 100% successful if other actors and other sectors didn't know their role in protecting children or how to respond to children in distress. Another tip is to include indicators that measure change on various areas, including child protection outcomes, but also gender inequality and exclusion, community engagement, and shifts in social and behavior change. This is really significant for all of us across sectors and can sometimes get lost in between. This will also help us to look beyond the immediate impact to the wider environment and the consequences, both positive and negative, of our work. And as Kathryn mentioned, the integrated framework also promotes community-based data collection, especially in places where community members have already learned and practiced doing this prior to COVID-19. Another key recommendation is to conduct safety audits of all facilities, which helps us to look at the needs of men, women, boys, and girls, and to look at their needs holistically. This also gives us feedback from individuals themselves on how they wish to receive services and what makes them feel safe. We also need to ensure that we're evaluating the access to services of high risk and marginalized groups and ensure appropriate age and gender sensitive and accessible listening, feedback, and reporting mechanisms. And beyond this, as was mentioned and highlighted in the coordination element and from Claudio, we need to speak the same language and make sure that we're engaging relevant actors such as the GBV, gender-based violence and child protection area of responsibilities, and also disability persons organizations. This will help us to learn how to get feedback that is child-friendly and inclusive. One thing that the integrated framework highlights that I think is so critical is the need for MEAL to lead on producing program reports, midterm reviews, and evaluations that highlight and demonstrate the benefit of joint programming and shows us how we can further link our sector's interventions. This will also help us to define lessons learned for future refinement and optimization. These reports would also highlight priority cross-cutting issues, maybe that's safeguarding, gender equality, and inclusion. And I know that this maybe sounds quite lofty and ambitious, but what we're saying is that we need to actually think about this during program design, that we're allocating enough time for multidisciplinary writing workshops and reflections, and so that we can enable our MEAL colleagues to reflect on and to monitor cross-sectoral integration, rather than just compiling single sector reports into one report, which I think we've probably all been part of. I know I have. So the integrated framework shows us that MEAL is critical not only to determining if we've succeeded, but also to guide us to better improve our responses to individuals and outbreaks. And with that, I'm going to hand back over to Maria.
Thank you very much, Laurie. And it's great that you already answered to some audience questions as well. So we actually have a few questions in the chat box that are coming through. Before going to that, though, I would like to combine a question. So one of the questions that came from our audience is, how can we ensure integration across sectors without overloading staff who are already dealing with huge workloads in an outbreak response? Before starting about overloading stuff, I will start of the basis of the roles that we usually overwhelm, and that is the community health workers and the community volunteers. So we all know that the importance of community health workers and community-based volunteers at the COVID-19 response. In the framework, actually, under the technical sector guidance, you will find several times mentioning a variety of tasks that this frontline important cadre of people can lead on at community level. So how do we know this will not overburden them? Let's pause here and let's ask ourselves, actually. I think there is no other way than actually asking them. If I was a community health worker, I would like to have agreed upon the tasks I need to perform in advance. I think it's quite logical. Therefore, always remember to have agreed upon actions, TORs, messaging, and if it is possible, developing the TOR together at a co-creation workshop is ideal. And by co-creation, I think here, again, I will pause and we need to break the terms and really co-create with the community together. Do not underestimate the innovations at the community level and their ideas to fill in the gaps based on community level capacities. The framework highlights the need for coordination among sectors, development of clear roles and approaches specifically for the community health workers, specific messages, and most importantly, a unified approach to training and supervising them. And with that, I will extend the question. This is approximately how we are not overloading community health workers and an approach and a unified approach on working together. Claudio, did you want to add anything on how we will not overload our own staff?
I was thinking of the way that we try to engage with the communities and we try to work with them. I don't know, from Bangladesh in Cox's Bazar, from Yemen and in DRC. The way that we try to develop the messaging together with some representative of the communities, and then also having entry point and relation with the community and health worker, one group of people representing multiple sector instead of creating several flux of communication, as I see in the past years ago. INGOs were approaching community 2-3 times a day with 2-3 different sectoral teams going and confusing people and also delivering message in a way that were not really culturally appropriate. So things are changing now and things are developing in a way that we all work together and we try to reduce this burden as well.
Thank you very much, Claudio. So maybe we can take one more question and we see to discuss from our audience, from our chat box. So there is a very interesting question regarding with reference to the project cycle, how would you ensure staff are adequately engaging communities in setting up isolation centers during COVID-19? And this is a great question to have because it integrates two pieces of the framework, not only the technical part, but the entry points of the project cycle. So Kathryn, would you like to give us your opinion about, as an RCC expert, I think you will provide a lot of information for us. Thank you.
Yeah, thanks so much. And thanks so much for the question. It is a great one and an important one. And I think some of this has been touched on a bit and even in Claudio's last response there, but it's really critical, of course, that we are, engaging these communities as we are setting up thinking out even the design of the isolation centers and all throughout the entire process. And so looking at the project cycle, I mean, again, we can kind of start at even the proposal stage and making sure that, community engagement is a big piece of that proposal. And we need to make sure that community engagement, risk communication, focal points are sitting at the table in those coordination mechanisms, and that our staff across all of the sectors are properly trained in how to conduct participatory and inclusive risk communication and community engagement. Importantly, you know, it's important for us to be ready to be able to engage with these communities. And so building that relationship from the beginning is going to be really important. And so it's important that we have those relationships, that we have those contacts with those communities, that we know who to reach out to and who's trusted, and start that process. And on the Ready website, and this is linked to from the integrated framework, we do have a very nice 6-step process of how to engage communities from the beginning of even building those relationships and orienting, you know, both leaders at the municipal, at the district level, down to the community leader level, and those community member level, and orienting them on that process and on the engagement throughout the process. And so there are some resources available on how to do that. And then I'll just close with saying, importantly, and kind of referencing Lori and her piece on the on meal. You know, it's important that we're being accountable for that community engagement. And so having some indicators around community engagement and, you know, how satisfied are communities with the way in which we are engaging them and including them in this process, I think it is really key.
Thank you very much, Kathryn. This is great. I will take one more question from the chat box, one that came, and it's really interesting, like, to close this panel discussion because it also offers a little bit of personal reflection for everyone. So I will kind of divert this question not only to the panel, but like for each one of us here, like to reflect on that. So the question is like, how do we change the culture within our project proposals so we design around alternative models such as life cycle or a health system rather than vertical design of each sector? Unfortunately, I'm not sure there is the actual response to that is available at the framework right now, but definitely the framework itself, it's a step to that direction on how we change the culture, how we are like systematically organize ourselves, not only at the project design or the project implementation, but also even before, during preparedness and during monitoring and evaluation and etc. The framework itself, as mentioned, is like it's one step together with a lot of other tools that might be available out there. I think some of them, there is an integrated matrix in the Adolescent Sexual Reproductive Health Toolkit as well, together with others. But definitely we need to all join forces if we want to change cultures around project cycle, around project design, around project development, donor cultures, our cultures, and overly how we work together and how we integrate. I'm not sure if, Lori, do you want to add something on that? Something more specific? I know you had the question on meal. It will be great to hear you.
Yeah, absolutely. Can you hear me okay? Okay, great. Yeah, I think it's a fantastic question because everyone I think is sold on integration. You know, if we talk to each other, if we talk within our organizations, everyone says, yes, we know integration is good, but it's actually bigger than that. It's trying to say, okay, well, yes, it's good, but then how? And I think that that's one thing that this integrated framework helps to answer. And I think I love the way the question was phrased around it being a cultural shift, because it does require us to, instead of go, oh, here's a call for proposals, here's our silos, let's bring it into a proposal. Instead, we're saying, I'm starting with an individual, I'm starting with a community, Now, how am I going to respond to their needs? So I would say that one of the really practical tips and resources referenced in there is some suggested and recommended joint outcomes. So starting with, okay, we want our outcome to be cross-sectoral integrated. Now, where do we start to actually measure that and design? So it's kind of working from the bottom up in a way, but it is a change in how we do this. And the last thing I would highlight, I mean, I mentioned allowing time for joint workshops to reflect, but I think it's also allowing time for when we're writing proposals to actually come together and brainstorm. So it's not just if I'm child protection that I go, okay, I know these are my 3 activities I always do, I'm just going to copy paste them from another proposal. But actually we're sitting together and going, all right, what do we do? How does it work together? And having that be a discussion from the start. Thanks, Maria.
Thank you, Laurie. And more questions keep coming, and I cannot stop. So I will share one more, which is about terminology and about creating common language. And the question is about what is the difference between multisectoral programming and integrated programming in a practical operational sense. And this is a great question because, as mentioned, integration is just a word. Integration within the humanitarian sector represents different things that we need to outline and create and explain and share with our colleagues in advance in order to create common language. So multisectoral integration, to me, and I think to most of us, it really refers to sometimes a siloed approach, like having one family, having an individual that you need to cover their needs. Either they are for, either their needs are health or a wash or food security or protection or nutrition. Having these needs and covering these needs by separate teams, it means that you're using so many resources. It is very important, and I think for me, this is the difference between multisectoral integration and an integrated approach. Is how from the start, and going back to the previous question, create a culture where the teams are working together and ensuring that it's not only about the coverage of the need of the person, but making sure that this coverage for all sectors is coming through diverse teams. And I'm happy to have anybody else from the team joining in this response. So please open your mics if you want to add on this and what it is for you, multisectoral, and what is it integrated. I'm happy to have somebody to join.
Yeah, I think you covered most of it. I mean, from my perspective, it's about making sure that, with a more integrated approach versus a more multi-sectoral siloed approach, it's really, and this again, I think was something you said earlier. I mean, you're not overburdening the communities with all of these different sectors coming in at different times. Maybe with their own sector specific messages, maybe with some conflicting messages. I mean, you're really kind of working together and seeing, okay, we're all working in these communities. We all have this similar outcome of ensuring the health and well-being of these communities. How are we going to do it together that makes sense so that we're meeting these needs? Again, like what I was saying earlier, in terms of behavior change, there may be some similar, types of behavioral drivers or social norms that, different sectors may be wanting to address. Why address it at separate times within your separate silos? Why not come together and see how jointly you can work with communities to meet their needs?
Thank you, Kathryn. And yes, as Claudio mentioned, multisectoral program does not mean a necessarily integrated program. I think I've seen a lot of scattered sectoral interventions in different geographical areas, in different neighborhoods, for different population, and I feel like sometimes like we struggle like to ensure that the one family, the one person will actually like have this full support that it's needed, like at the time of an outbreak response, especially, or at a time where they have to isolate and quarantine, like during COVID-19, as many of us. So with that, I think we will conclude with our questions. And now that we have reached the end of our panel, I want to once more thank all of you, the panelists, Kathryn, Lori, and Claudio, for your participation here today at the panel, but also for contributing directly at the framework itself. I also want to thank the READY consortium for bringing all of us together, and BHA for funding. Another person that I want to thank today, though I'm not sure like what happened with the French translation given the textures we had at the start, is Beatrice, for being here and supporting us. I hope we managed to sort it out at the background. And lastly, I want to thank all of you for our participants for being with us this almost 1 hour. And a couple of like end actions to take with us. We would like to remind you that we will first share the recording of the session in the next few days. In the email with the recording, it will also include a feedback survey for you to fill, which will be very specific on the framework and integration. So we are very dependent on you, like, to get feedback and continue the work on integration and creating culture, as we mentioned before. Please take this email and share it with everybody in your team that you feel might need to see it. Which, from what we discussed today, it must be everybody, and any other networks we are connected to. So feel free to share this recording with others. Another takeaway and another action for you is we will also request to indicate, you should indicate your interest in joining us to create an integrated community and continue the discussion and integration, as we mentioned. We will specifically continue developing integrated guidelines and tools like the framework that we present today, which was very specific to COVID-19, and expanded to major disease outbreaks. So in the coming months, we would definitely invite you, like, to join this dialogue, join focus group discussions that they're going to be on schedule for the next months, while we can all promote and also contribute in a follow-up iteration of the framework to cover more mode of transmissions or to cover major disease outbreaks, as we mentioned. I want also to remind you that to bookmark our website to be able to have access to our framework. You can also download it, watch the videos, share the fact sheet that you will also find available. But don't forget also to visit other tabs and other links that you will find in our website beyond the framework. I'm sure, like, there are plenty curated trainings and other material for you to share and explore. Again, thank you all very much. We are 2 minutes to closing. Have a great day, and thank you for being with us today.